President Donald Trump has taken one of his most controversial steps since returning to office. He has signed an executive order ending all federal funding and support for transgender healthcare for minors. The move, which directly impacts gender affirming care such as puberty blockers and hormone therapy, is already facing backlash. Trump's order states that the US government will no longer fund, sponsor, promote, assist, or support gender transitions for minors. It also calls for strict enforcement of existing laws that prohibit such treatments. The order reads, and I quote, "Across the country today, medical professionals are maiming and sterilizing a growing number of impressionable children under the radical and false claim that adults can change a child's sex through a series of irreversible medical interventions. This dangerous trend will be a stain on our nation's history, and it must end. Countless children soon regret that they have been mutilated and begin to grasp the horrifying tragedy that they will never be able to conceive children of their own or nurture their children through breastfeeding. Moreover, these vulnerable youths' medical bills may rise throughout their lifetimes as they are often trapped with lifelong medical complications, a losing war with their own bodies, and tragically, sterilization." End quote. This follows Trump's earlier ban on transgender people serving in the military. It aligns with his broader push against diversity, equity, and inclusion programs. Trump's conservative base is celebrating the decision. The Christian law firm Alliance Defending Freedom called it a refreshing return to sanity. But LGBTQ advocates and medical professionals strongly oppose it. Dr. Marcy Bowers, a surgeon specializing in transgender care, warned that Trump will have blood on his hands. Chase Strangio, a lawyer with the ACLU, called the move dangerous and vowed to challenge it in court. Lambda Legal, another LGBTQ rights group, has also promised legal action. Gender-affirming care has been endorsed by major medical associations. Studies show that such treatments can be life-saving, especially for transgender youth at high risk of suicide. Despite this, over half of US states have already passed laws restricting or banning gender-affirming care for minors. Some of these laws are being challenged in court. A case from Tennessee is currently awaiting a ruling from the US Supreme Court, which could have national implications. Trump's order targets Medicare funding for transgender healthcare. It also seeks to weaken Section 1557 of the Affordable Care Act, which protects transgender patients from insurance discrimination. Within 90 days, the Health and Human Services Secretary must conduct a review of existing medical literature on transgender healthcare. The goal: to increase government control over what care is considered best practice. Legal battles are inevitable. Critics argue that Trump is ignoring scientific consensus and forcing a rigid binary view of gender. Dr. Bowers points out that biology has diversity and gender is not simply male or female. But conservatives like Jay Richards of the Heritage Foundation claim that current transgender healthcare practices will one day be seen as a medical failure. The fight over transgender rights in America is far from over. With court battles looming, this executive order is just the beginning. Stay tuned for more updates.